Discrimination and violence in mental health. It is understood that within a mental health setting, there is a fundamental victimization and discrimination against mental health consumers, which is perpetrated by the media, the general public, and unfortunately mental health care workers, including nurses. Quite often, this victimization is categorized by the fear of violence surrounding the mental health community, reinforced by the media's misdirected attention and discrimination preserved by mental health care workers. There are many predictors to the violence caused by individuals living with a mental illness, including past trauma resurfacing, comorbidities with substance abuse, and victimization and discrimination towards the consumers. Therefore, violence and discrimination within a mental health care setting is a prevalent issue which acts as a vicious cycle, affecting both a healthy workplace environment and communal safety. Within a mental health care environment, nurses make up nearly 50% of the workforce and are subject to 24 hours of monitoring and care 7 days a week. This makes nurses an essential point of contact and trust for consumers within the clinical setting, allowing for nurses to have a huge role to play in the road recovery for consumers. Unfortunately, there is a large portion of nurses who experience both verbal and physical abuse from consumers within a clinical setting. Some of these nurses tend to experience higher levels of stress, leading to a reduced job satisfaction and burnout. The reasons behind consumers lashing out and becoming more violent towards nurses is often attributed to nurses distancing and ignoring individuals, and/or the nurses' attitudes or behaviors towards the consumers. These two factors can be attributed to the nurse's individual discrimination or possibly fear towards a consumer, but can be also caused by poor teamwork, management, and leadership within a clinical setting, forcing nurses to spend less time with the patients and have less interaction. When addressing patient safety in a mental health care setting with a presence of discrimination and violence, there is often an atmosphere of fear and discomfort surrounding the consumers. When there are other consumers who begin to exhibit violent behaviors, this is an issue which has affected a majority of individuals who have been admitted to mental health wards and can exacerbate symptoms of anxiety and PTSD. Another factor when addressing consumer safety is the use of both physical and chemical restraints during violent and unpredictable behavior, which can ultimately resurface or inflict more trauma on an individual. The role that effective leadership plays to resolve these issues revolves around addressing and reducing workplace stigma and discrimination, and remaining calm, confident, and professional in high-intensity situations involving highly acute consumers. These leadership techniques can be translated easily into different areas of nursing, but has a significant impact within the mental health sector due to a history of discrimination and bad practice. Having leaders within a clinical environment that improve the workplace atmosphere and reduce negative attitudes towards individuals living with mental illness dramatically changes the collective attitude towards consumers. Although escalation of violence within mental health can be attributed to a huge variety of factors and can always be unpredictable if nurses can adopt a leadership attitude, reducing stigma and discrimination both within and outside a clinical environment amongst peers and consumers, there is potential for reduced violence and therefore reduced workplace stress and burnout. Currently, there are plans to improve the workforce within mental health, This is from the New South Wales Strategic Framework and Workforce Plan for Mental Health, which is set between 2018 and 2020. Although there is a huge variety of plans and strategies in place to improve the workforce, there is a massive emphasis on improving nurses' clinical leadership and training with highly acute patients. The leadership skills addressed are based around fairly simple concepts that all nurses would have been exposed to, whether from the Nursing Code of Practice, Code of Ethics, or the core values. These documents and concepts revolve around the safe, ethical, and professional practice that nurses have a responsibility to abide by. The Nursing Standards for Practice clearly states to adopt a practice that avoids bias and discrimination, and the Code of Practice for Nurses stating to advocate for all individuals respecting rights and autonomy. These standards and codes of practice are the foundation for the leadership skills addressed. The responsibilities associated for new graduate nurses to adopt revolve around following policy, the Nursing Code of Ethics, Standards for Practice, and continuing education and training. All nurses have a responsibility to maintain their own standards of practice and advocate for others who may not have a voice. But as individuals who have had extensive training in appropriate nursing standards, for new graduate nurses have a responsibility to translate this training and education into their own practice, reinforcing this with confidence in practice and advocacy for all individuals. New graduates also have a responsibility to continue their own professional development and education to ensure their practice is based upon the most recent and reviewed evidence-based training. This training could include de-escalation of violent and high-risk situations and approaching highly acute patients with calmness and confidence. It is also important for new graduate nurses to understand the professional and ethical boundaries that are in place to ensure both the consumer and the nurse's safety. An important element of the professional boundaries which translates to the issue refers to nurses building therapeutic relationships with select consumers based on their favoritism rather than treating every individual with respect and care without judgment or bias. This professional boundary must be made with all individuals under a nurse's care to reduce opportunity for escalation and ultimately patient safety. The research and policies that are discussed to reinforce a variety of the points made throughout this presentation. The contemporary research documents and policies showcase the extensive evidence of the issues, both discrimination and violence within the mental health sector, and how these two issues are interconnected and tend to perpetrate each other. The policies provided show the foundations for leadership practice that are easily accessible and available to all nurses. This evidence has been communicated in the presentation of a narrated PowerPoint video with concise and written points made to highlight the essential information and narrated into further detail to ensure focus on the topic is kept as a priority. This is also done to ensure that the PowerPoint is easy to follow and communicates the arguments efficiently and without confusion. In conclusion, this presentation has been made to demonstrate and identify the risks and issues that are prevalent within the mental health care environment, how these issues are interconnected and can progress and evolve into further issues in the future. It identifies how discrimination within mental health can be caused by violence, and how violence within mental health can be caused by discrimination. The leadership techniques that are addressed within the presentation revolve around reducing discrimination by adhering to the Nursing Code of Conduct and the Standards for Practice, and maintaining a calm and professional attitude around consumers. Expressing these techniques in this setting can cause a ripple effect in the environment you work in, causing others to feel more comfortable and confident. I hope this presentation provides necessary information and tools for others to follow. I hope the implementation of these ideas breaks the cycle of discrimination and violence within mental health improving both patient safety and a healthy work environment.